And welcome to the latest in our series of live careers webinars brought to you by the Hertfordshire Opportunities portal, that is Hop Into. Hop has been created for students who go to Hertfordshire schools as a way of trying to share with you some of the many opportunities that are out there for you as future career options. Hop was created last year, and we have been sharing it with nearly all of the schools in Hertfordshire. So we hope if it's not something that you're familiar with at the moment, that it's something that maybe you're going to have a look at on the back of today's session. So that website address is hopinto.co.uk. You can probably see just around the side of my head there, I've got a poster strategically placed behind me with that web address. We'll show you how you can access that later on in the broadcast though. So the purpose of these live webinars is to enable you to hear directly from people who are doing jobs or are in industries that you are interested in finding out more about. So we cover a different career every week, and today we are looking at nursing associates. So that's a very specialist area of nursing, a very innovative and a new way of getting into nursing. So our panelists today consist of, if you just give everyone a wave as I say your name, so we have Caroline Holmes, who is the Student Nursing Associate Pipeline Manager for the Western Herts and West Essex Integrated Care System, but that is part of the wider NHS family. And then Tonie Magiya, who is a Registered Nursing Associate. Tonie, you will hear from in a minute, has got a very inspiring story to tell you, but his role now involves working in the community with patients and service users with mental health conditions. Let me just explain to you how this webinar is going to work. So in a moment, Caroline and then Tonie in turn will tell you a little bit about their careers and their roles at the moment. And Caroline's got a very informative presentation to show you on screen as well. Then we'll come back and I'll ask a couple of questions of Caroline and Tonie just to find out a little bit more about the things they've told us in their introductions. And then hopefully we're going to get lots of questions from you guys in the audience. So those of you that are watching live now, just to reassure you, we can't see you or hear you, but hopefully you can see and hear us. But you do have the ability to ask questions of Caroline and Tonie. The way you do that, on your dashboard that you should have on your screen now, one of the options on there is questions. If you click on the questions tab, you should find that little text box comes out, and within the text box you can type in your question. So those questions will only be visible to me, so they won't be visible to anyone else. If you type in what your question is, and if you want either Caroline or Tonie specifically to answer it, that will be really helpful. But if you just want to ask the question generally, that's fine. And then I will forward that question on, and then Caroline and Tonie will answer that question for you. So hopefully that should give you some really, really good information and some really good insight about what it's actually like to be a nursing associate. At the end of the session, we will show you how you can find this webinar, which is recorded. So if you do have to drop out of the session for whatever reason, you will be able to watch it back. So we are recording it. All of the other previous webinars that we have run are also available on the Hop website. So if you want to find out, or any of your friends or family want to see a similar webinar about a different career or a different industry, then we will give you access to that. So look, let me start with Caroline, because she's got a very informative presentation for you. Caroline, just before you actually give the presentation though, could you just tell us a little bit about your background and how you've come into nursing?
Okay, yeah, thanks Gareth, thanks for the introduction. So my background is nursing. I'm an adult nurse by profession, but I've had various experience and careers in community, mental health, and in the acute setting along the way. I've been in the NHS for over 30 years now, which I can't believe, it's flown by, but yeah, so that's my background as a nurse. I'm in the current role of Student Nursing Associate Pipeline Manager, as Gareth says, and my role is, as the job description explains, to keep the pipeline going, so to have more nursing associates going through, to qualify, such as Tonie has, and to recruit externally, and as well as using an internal sort of pool, if you like, of healthcare staff who might be interested in becoming a nursing associate, to promote and get wider recognition of the role outside. So particularly for your group, to look at, you know, how you apply what you can do. So it's really with the aim of increasing the number of nursing associates in the future to fill the gap that we've currently got between registered nurses, which is what I am, and health support workers, if you like, clinical support workers. So to have somebody in between those, so that's what the nursing associate role is.
Fantastic. And so just before you to give your presentation, Caroline, Tonie, could you just tell us a little bit about your role? Because being a nurse wasn't part of your initial career plan, was it, when you were leaving school?
No, it was not. So yeah, so I did engineering before I came into nursing. So I was just working as part-time just on a weekend, just like every other teenager when you leave college or school, you're just doing some part-time work. And I did so after I finished engineering, I knew obviously that that was not something I really wanted to do. I just found a new passion in doing in nursing. So I worked on inpatient a few times, some local hospitals as well, Signal Hospital, which is in Stevenage. So yeah, so I worked local. Then I just thought, you know what, that's what I really wanted to do, nursing. So where I was working in Luton, it was a bank, so I was not permanent. I worked with a bank and agency. So when I moved to HPFT, which is Hertfordshire Partnership Trust, in Welwyn, that's when I got the opportunity to be a nursing associate. So this opportunity, obviously, I mean, being a nursing associate, because it gives you quite a wide range of like things that you could do, because you do learning disability, you do children's nursing, you do mental health, general nursing. So it's such a wide range. So if you're not too sure, obviously, like what you really want to do in the future, it kind of helped me in that aspect. I always knew that I wanted to do mental health, but obviously for some people who don't know what they want to do, this would be a very good path.
Yeah, okay. Well, look, we're going to explore all of those things that you've just said, but I've got to ask you this, Tonie. So you did a part-time job. Now, I guess most young people, when they're doing part-time jobs alongside their studies, they'll go and work in the local supermarket, or going back a few years, you might have got a paper round. What made you think that you wanted to go and do part-time work as a nurse in a hospital?
So I think I had a friend who suffered from agoraphobia before. So it was quite sad because he couldn't go out. And I mean, I did go see him quite a few times, and then just helped him out with a few things like shopping and all that. So, but we're still young at this age. So for some at that age, obviously people still think that it's just weird why someone doesn't want to come outside and do all the other activities that teenagers will be doing. So through that, I saw a flyer when I was going to do his shopping at Asda's, that is back in Dunstable, that just said, "Oh, nursing. If you support workers required, just apply for part-time or full-time work." That's how I got into it, because I just thought, oh, I could do a little bit over the weekend. At first, I was actually volunteering to do that. Then one of the managers said, "Oh, you're quite good at like communication skills, talking to patients, caring. So you should try and venture into it." Then I did apply for a permanent job. That's how I started working in nursing.
Okay, well, that's fascinating, and so we'll go back and explore and unpick a little bit of that later on. So look, Caroline, let me hand over to you so we can go through your presentation.
Okay, thank you, Gareth. So this is my presentation. I'll try and make it, it's something that's informative, but I'll try and sort of go through it and explain as I go along what each of the terms means, and anything that might be a little bit to do with jargon in the NHS. So what is a nursing associate? So as Tonie has just explained about his role and how he got into it, the nursing associate came about really because they recognise that we're not perhaps getting enough within the NHS, enough registered nursing applications. They've gone down considerably over the last 10 years. And although we have clinical support workers who provide support to registered nurses in the healthcare setting, we needed to look at how could we have somebody in between that, a role in between that has some of the skills of the registered nurse and skills as a clinical support worker, really to sort of fill that gap. and to do it as an apprenticeship route, so you earn while you learn, and you can develop clinical skills, gain knowledge, practical experience in physical health, mental health, learning disability. So the opportunities are endless, really. You can go into a hospital setting, which is known as the acute setting, and do all of the assessments and clinical work that's involved there. But you've also got the opportunity, once qualified, to go into mental health, and perhaps into areas of learning disability, also into GP practices or care homes. So there's a lot of opportunities once you qualify as a nursing associate. And the skills could involve carrying out clinical observations, so it's the usual things: pulse, blood pressure readings, etc. Giving injections, and certainly at the moment, because of the COVID vaccine, vaccinations are very high on the agenda. And of course, they're looking for staff to be able to give the COVID vaccine. And the advantage of having a nursing associate, that once they're qualified, they can do, as I say, many of the roles that a registered nurse. So registered nurses, adult nurses or children's nurses, would be qualified nurses who would normally do the kind of things like injections, but because we've got this extra role as a nursing associate who can do those types of things, it kind of adds to our workforce. And qualified nursing associates, as I said, have gone on to GP practices giving childhood holiday vaccinations. So when you're going on holiday, to check that you've got the right vaccinations, that you need to go to particular countries. Infection control, that's obviously a hot topic at the moment. So that's one of the areas that generally registered nurses, qualified registered nurses would go into. But that nursing associates can go into. So it's obviously looking at infection prevention control, controlling outbreaks and pandemics, as we're in at the moment. We have a qualified nursing associate who works in the kidney dialysis unit at the Lister, which she loves, and she's brilliant at the role. And her role involves putting people onto dialysis, and checking their observations during dialysis, and a sort of one-to-one approach really with patients, so that she's giving them one-to-one care. She knows her client group very well because they come in every day, and it's a really rewarding area. And health and well-being, that's something that we're looking much more at, with the population, in terms of health generally. How are people feeling, particularly at the moment with lockdown? What's their mental well-being like, health wise, and also just getting access to health, because it is more difficult at the moment for people to get GP appointments. But in GP practices, certainly the nursing associate has a really, really useful role in understanding people's well-being and performing assessments in that area, because they have the experience and the training to do that. Family and carer liaison, definitely within mental health and in physical health and in learning disability. It's such a key and important role to involve somebody's family and their carer. Could be a nominated carer who's a professional, or it could be a family member or a friend who takes on the care of that person. And that's particularly relevant at the moment, but in home settings, where people have access to healthcare, but can't travel to GP practices, can't go into clinics. So that's really, really important for that support from a nurse or a nursing associate to be able to give them the support they need. So why be a student nursing associate? Well, you can earn while you learn on the apprenticeship route, which is brilliant, because otherwise, if you wanted to get into become a registered nurse on the course, you would have to get a student loan or fund yourself, so you don't have any student debt. You can gain an apprenticeship qualification and a foundation degree qualification, and Tonie will talk a bit more about that, about how that was achieved and how he got through that. Develop your academic skills, obtain practical experience through supported placements. And I have to say, the placements in terms of going out to areas, healthcare areas within a hospital setting, community setting, GP, mental health or learning disability and care homes, you do get absolute support. So there's a nominated what we call assessor, so they assess all your practice to make sure you've gained the relevant experience. and that you're competent in certain areas, and also somebody who supervises that. And we also have student surgeries that are carried out virtually, so you can visit and you can, you know, express any concerns that you have. You get a lot of support from our university. It's run currently by the University of Hertfordshire, and of course that will allow you into the university life, but actually while you're not, you know, having to fund yourself or get a student loan, and you can build great friendships through that. I'm sure Tony will talk a bit more about how he's created new friendships through the course. Take your career to new heights, because it does open a lot of doors. A nursing associate role, you can go on then to do another 2 years after you've done the 2-year foundation degree course to become a registered nurse. It's much easier that you've gone through that process as opposed to going through direct entry if you so wish, because it gives you sort of, it might be a slower route, but it gives you that clinical support going through, and the academic skills that you need, and to be the best nurse you can be. So this is, sorry, a bit busy, this algorithm here, flowchart, but why train? So you grow personally, you go professionally, and in your learning skills. Personally, it can create challenges, but those challenges then are sort of, you know, good building blocks to get you into other areas that you might want to progress into in healthcare.
Caroline, sorry, can I just stop? The slideshows aren't moving on our screen.
Oh, are they not?
No.
Oh, I'm
so
sorry.
We've still got the first screen on there.
Oh, I'm sorry.
There we go. That's right. Thank you for the person in attendance who pointed that out to me, because I hadn't picked up on that either. I was listening to what you were saying so intently. Thank you, Caroline. Yeah, it's moved on now. So
good. Okay, apologies for that. I'll go back. Sorry, where have I got to? Let me just look. Okay, can I go ahead and just restart?
yeah, click back at your own pace. Yeah, we can see that's moving along now. Yeah.
Great. I'll just go back to, that's the one, yeah? You can see that?
Yeah.
Why
so
study?
Why train to be a nursing associate, and then you've got the wider flow chart coming from that.
Good. So increase in salaries, as I said before, it's very easy to progress in healthcare, providing obviously you've got the right skills and qualifications, and certainly a nursing associate gives you a great stepping stone to becoming a registered nurse and going on to work in different areas. So you don't just have to focus maybe on a hospital setting, where you might be more interested in community settings, as I said before, mental health, learning disability, or care homes, or GP practices. Professionally, you know, and of course added to that, you've got a lot of skills to learn, greater experience professionally, to work in new areas. Sorry, has it gone off again?
No, you just need to click onto the next slide. So it's gone back to
yeah, I don't know what's happening here, because I'm
that's all right.
kind of sorry.
There we go. Yeah. So apologies for those of you watching. When you present on here, you can't see what of your screen is showing. So I've done this myself before, but anyway, look, we can still see it. So
okay, and gain academic skills. I think that's really important to, you know, get that academic grounding, which you probably wouldn't get necessarily, you know, if you went, say, straight from school into nursing. You would have had experience of academic learning, but this gives you that kind of phased approach, if you like.
Okay, yeah, so I need to click on it.
Build new friendships, and you end up with your foundation degree course. The other bit that I should say is that you're able to do certain things such as a registered nurse could do, and then that will allow you to become a registered nurse if you so want to. And then you get regulated by the Nursing and Midwifery Council, so all healthcare professionals within nursing, apart from clinical support workers and healthcare assistants, are regulated by the Nursing and Midwifery Council. So you get a pin and you've got that protection, an added bonus of being a professional. And you start at a band 4 level in the NHS, which can go up to around 24,000 maximum. So, you know, I think Tonie as well perhaps can talk a bit more about that, about the salary and the advantages of having that academic background. To begin your training as a nursing associate, you'll need GCSEs grade 9 to 4, A to C, Maths and English. So Maths and English is an absolute requirement. You must have that level to be able to progress and to be eligible for application. And you need to really demonstrate your ability to study to level 5 foundation degree level and commit to completing the nursing associate apprenticeship programme. But you do get lots of support. Some student places are available through direct applications and not through the apprenticeship route, but that would mean that you would have to fund it yourself, you know, via yourself or a student loan. Academic study, you'll undertake academic learning 1 day a week at the university, and the rest is practical learning, so on placements in various areas. But you will always start off in the area that you are employed with. So for instance, if you're employed by the Lister Hospital, you'll always start off with them in your first placement. And the settings can be varied, as I've mentioned before: hospital, community, mental health, care home, or hospice. We have nursing associates training at the moment who worked in hospices, but going out and getting more experience in other practical placements, and then going back to the hospice. So, you know, there's a lot of breadth to the role and a lot of opportunities. So you'll need to travel to the placements and work different shift patterns. So I think that's important to note that, you know, there could be night shifts and there could be late and early shifts. It tends to be long days, 8 till 8. But again, Tonie will be able to explain a bit more about that. So I'll kind of just go through this, and we're nearly at the end of this, but this just shows the type of skills and experiences that you may not get on other programs. So physical health, mental health, learning disabilities, children. A lot of our, well, not a lot, but some of our nursing associates have gone into children's nursing, and, you know, reap great benefits from that because of having that regulated role, and you can go on to do various things that nurses would do already. So that gives you a little bit more of a kind of job satisfaction, if you like, that you're going on to do things that you perhaps wouldn't be able to do at a different level, say as a healthcare support worker. A&E, you know, that's another setting. People like to be where the sort of everything's happening. And medical wards, you know, again, community settings, mental health, surgery theatre, oncology, which is cancer treatments, renal, which is, I mentioned before, about kidney dialysis, learning disabilities. Palliative tends to be people at end of life but may need treatment, and that's, again, from the members of staff that work in the hospice, it's really, really rewarding for people. Although they're at end of life, you can give the best care and you can plan the care and involve the family and the client and the patient in that. So it's a really important area. And school nursing, for those of you who might be interested in working in schools to support pupils if they have health needs, and again to do vaccination programs. So this kind of gives you a little kind of pictorial visual idea of what's available once you are a qualified nursing associate. So, and really sort of about the teamwork, I think I can't emphasize enough about the teamwork within the NHS. I think Tonie will hopefully confirm that in the NHS it's very much part of the team, because the work is quite challenging and rewarding. But I would say that working as a team is one of the greatest things with the NHS, and particularly at the moment with challenges we have with COVID, that more so than ever people support one another and you know, help each other, and towards the end of helping their patients. So I would say that it's a great environment to work within, and people do support one another, staff and patients alike. So I'm just going to give you quick difference between registered nurse. So you'd know that a registered nurse, you go straight in from school, but you obviously have to have the A levels to qualify for an honours or ordinary degree. So registered nurse is an accountable professional. Well, same for nursing associate, because they're registered by the Nursing and Midwifery Council. Promoting health and preventing health, definitely the same. We're very much in the sort of area of promoting and preventing, because we want to prevent, to get to this, you know, to avoid getting to the stage where people have illnesses that need treating. Assessing needs and planning care, that tends to be carried out by the registered nurse, I would say mostly in the hospital setting, but the nursing associate definitely has a valuable role in providing and monitoring care and work in teams. And I think that's the same for both registered nurse and nursing associates. Providing and evaluating care, so care delivery, but evaluating whether that care is working. And I would say definitely for the nursing associate, improving safety and quality of care is absolutely important. Leading and managing nursing care and working teams. You know, the lead would definitely be the registered nurse, but you know, a senior nurse, say a staff nurse or a sister on a ward or in a community setting, but the nursing associate would contribute to that planning and management. And really, we're all in the business of improving safety and quality of care and coordinating care, so that's the same really for both. But it gives you an idea of the kind of responsibilities and the differences, which there aren't, I have to say, not huge amounts of differences. So you really are, as a nursing associate, getting that experience of being, you know, managing care, leading, being accountable, promoting and preventing ill health, and improving safety and quality of care. So that is the end of my slide. So I'll hand back to Gareth to introduce Tonie.
Yeah, thank you. Thanks, Caroline. That's a really impressive presentation that you've got there, and I think you've covered, actually, we've had a lot of questions come through already, a lot of which I think you've probably subsequently answered, but we'll try and get through those. So thanks to all of you who have submitted questions so far. Hopefully you've seen it's a fairly easy process to do, so please do keep those questions running and we will get through as many of those as we can. I guess my follow-up question, you kind of alluded to this, Caroline, I'm keen to get Tonie's take on it, that really, what are the benefits and the disadvantages for following a nursing associate scheme compared to completing the full degree? So from your perspective, Tonie.
I guess I'll start with the disadvantages, then go into the advantages. So I guess like the disadvantages, obviously, it will take longer for you to become a registered nurse if you want to become a registered nurse eventually, and obviously, like there's certain things that you can't do on the ward as a nursing associate that, you know, if you were a registered nurse you would. I think we've got more disadvantages than we have less disadvantages than we have more advantages. We've got quite a lot of those. So in advantages, I guess one of the most important things is the fact that you earn whilst you work. I mean, who doesn't love that? Everybody loves that. So, you know, you get the opportunity to, you know, you're still working, you're still getting all the skills that you need, and at the same time, you know, you're still getting paid, which is one of the most important things, financial situations. And another thing, obviously, you don't incur any debt to the government. So, you know, when you go through the nursing associate, your employment, there is this money called the levy, if I'm not mistaken, which is paid by every trust to the government. Whether you've got people that are going to uni or not, they still need to pay it, if I'm not mistaken. So, you know, you just be accessing those services. So they're paying you to work, to learn. At the same time, you're still not incurring any debt to the government. And another thing, I was writing things down when when Caroline was talking, which I wanted to say. I guess you know, another advantage is the fact that you get more skills in different sectors of health. So whether it's children, whether it's learning disability, or it's adult, or it's mental health, you know, you gain more skills. And when you gain those skills, if you didn't know what you wanted to do at start, I'm sure by the end of your course, you probably have more, more knowledge of what you will actually want to do. It's sort of like a process which makes it much more easier for you to choose from. Whereas like when you go from not going anything against, obviously, when you come from sixth form going into uni, but when you get into sixth form, then get into uni, you sort of like just apply for what you think you want to do. And when you get there, you sort of like think, well, hold up, wait a minute, I don't think I really want to do this. I probably would have gone for something else. I mean, you still have the option to change, I think, if you're into your second year, but obviously for some people, they won't know until it's sort of like too late to realize that, what, I didn't want to do this, I should have done that. So that's another advantage. And also, I guess like the friendship that you meet, the family, sort of like a family. Like those people, the people that you study with, you go into. I did my one of my placements was in A&E. I'm glad my manager is not listening to this. But my placement was in A&E, and I really enjoyed. I think that's one place I could actually work, apart from like doing what I'm doing in mental health community. A&E is one of the areas that I probably work. That was in Watford, and like the team there, everybody like helping you out. You feel like a family. It's sort of like a bubble. We keep talking about bubbles at the moment. It feels like you're a little bubble, your own family, and they're there to help you out and to support you with everything that you need. So I think those are sort of like the advantages and disadvantages of doing nursing associate.
Yeah, I think that's a very full answer based on your own personal experiences there, Tony. I think that's really summarised those main advantages and disadvantages. I mean, just kind of to wrap up that conversation, Caroline. I mean, some people, when they're considering whether they want to go to university or not, some may want to, some just genuinely may not want to go to university for other reasons. It may be nothing to do with the academic study side of it. But if someone was thinking, look, I think I might want to go to university to study nursing, but then I'm also really interested in this as well, how would you sell that nursing associate role as opposed to going to university?
I would really echo what Tony said, that first of all, you're earning while you're learning, you don't have the student debt. It gives you the opportunity as well to experience different settings and understand where you might want to work in the end. And I think it gives you that time so that you feel sometimes if you're going straight into university setting, it might be that you're not absolutely sure, as Tony said, but it gives you the time to reflect and to get that experience. Does that answer the question?
I think so. And I think probably using Tony's example earlier, you had that real sliding doors moment, didn't you, Tony? I guess of getting that part-time job in there, that had you not got that part-time job, or had you not seen that advert in Asda that day, there's a good chance you'd have pursued the engineering career that you foresaw for yourself, and you may never be in the situation that you're in today.
Yeah, 100%. Yeah.
Sorry, Tony. And I was going to say, one of the ways, I mean, definitely we've got the Health and Care Academy website. So if you type in Health and Care Academy website, it will take you to that website where you can look at Herts and West Essex pages and how to become a nursing associate. But what I would recommend as well is perhaps some work experience if you're already thinking working in healthcare. At the moment, of course, it's quite difficult to get some of these roles because of COVID, but voluntary organisations within hospitals and open a door for you to go in to be a volunteer in healthcare. I mean, certainly from my own experience, I worked in a care home when I was 16 and got my experience that way to understand what was involved. So I think that's one way of getting in, but I would recommend visiting the Health and Care Academy website pages for more information. We are doing some promotional campaigns at the moment for the nursing associate role. So you will perhaps see, we're trying to do a campaign where, maybe backs of buses, those kind of things. So you will see more information about the nursing associate. So I'd say just to kind of pursue that as well. You can always, anyone can come to me at any time. I could, leave my email address if you wish, just to get more information or to understand how to get into it, and also the work experience side of it. Because I think, as you said, Gareth, Tonie's view is so powerful and his experience is so powerful that, you look at one opportunity, you think, oh, yeah, that's what I want to do, and then you see something else, but you don't always know about it. It's not always available to people. They don't, perhaps healthcare is quite mystical sometimes. I think we have a lot of jargon. People don't really understand how it works, and most people just, perhaps their first point of contact would be a hospital setting when you go into A&E, I don't know, with an injury or illness or something. But there's so much more, with mental health, GP practices, supporting people in health and well-being, and prevention as well is such an important factor at the moment. So we prevent people from getting to that stage where they become ill, they become dependent, and obviously a lot of that care is provided out in the community and not necessarily in a hospital setting. So people always will think initially perhaps hospital setting, but there's so much more available, and so much more, I would say, in terms of career opportunities. I went from 16-year-old in a care home. I did then it was kind of training on the job really as a nurse, but gained my registered nurse qualification. I've worked in infection control, I've worked in mental health, and I'm doing this role now, which is kind of covering Herts and West Essex. So it's brilliant. The opportunities are just endless, I think, and the opportunity to career progression and promotion, I think, are really important. And we're looking at the moment for people with equivalent skills externally, and also for people to join healthcare in the NHS, to support the whole progress of things going forward. And definitely with the COVID vaccine on the horizon, there's a lot more work, but it's exciting times, and it is, more than ever exciting to work within the NHS.
For sure. We've got some really good questions that have come in, some of which I think you've already answered, so you can perhaps just give a sort of yes/no answer to some of these. So the first question that came in is, can you go into palliative care? And you actually spoke about that, Caroline. So yes, I guess is the answer.
Yes, it is. And how that would work would be that we'd look at the hospices that are partner of our partnership within Hertfordshire. So we've got Peace Hospice in Watford, we've got Isabel Hospice in Welwyn Garden City, and we have St Francis Hospice in Berkhamsted, but they're all employing hospices, and they are people that will employ an apprentice to go on to become a nursing associate. So the idea is, as Tonie said, there's an apprenticeship levy, as they call it. So it's a kind of fund, a pool of money there that all trusts, organisation within healthcare contribute to, and they take that money out to fund employing an apprenticeship to take on the nursing associate role. So definitely at the moment we have nursing associates who are training and have been initially employed by a hospice. So I'm happy to answer directly by email or any other way if more information is needed.
Sure. Okay. There's a couple of questions that came in, I think, just before you actually spoke about it on your slide about entry requirements. So I think we've probably answered those.
Yeah.
You said the most important thing was GCSE grades 9 to 4, which is A to C in old money, in English or maths. Now, Tonie, this is a conversation we had before the call, that often people say, well, why are English and maths so important skills in nursing? And perhaps you could give us some really good examples of just why it's so important that you have that functional level of English and maths in your role.
Yeah. So with the English, I'll start with. We do reports, we do assessments. That's part of like our work. You assess each and every time you see a patient. Each and every time you're in a situation, there's an assessment that has to be done, and so you have to write it down. It is important for you to write as all the information as possible, so that the next person that's going to read it will be able to understand it. So that's sort of like the most important thing when it comes to like your English. And with your maths, we deal with medication every day, and especially if you end up on the you giving patients medication, and sometimes you have to divide milligrams into mils. You have to divide kgs, kilograms, milligrams, all that sort. So it is important to understand, to know your multiplication, your division, your addition or subtraction, to see the amount of medication you're working with. Whether you've got too much medication, you need to half it, or you need to take 2/3 of it. So it's really important to have your maths and your English.
Sure. Okay. So it's just clarifying. So we're not talking about having knowing Pythagoras' theory or
No,
knowing the works of Shakespeare in English and maths. Very much those functional skills that are really important, though.
yeah, those functional skills. You don't need to worry about your Pythagoras theory. I did that when I did engineering, so you don't need all of that.
So you're actually okay with that, but
Yeah.
yes, that's why it's important that you have those functional levels of English and maths in there.
Yeah.
And I would say there's still the support for people. We wouldn't just throw people in and say, right, get on with that and do your calculation. And actually, drug calculations are so much easier these days. I say these days, but I mean, I think that they do tend to prescribe according to what somebody's body weight and all that kind of thing. So it's likely you won't be doing those calculations, but it's a good example, Tony, and I think you still need to be aware of it. So I think that basic level of division, subtraction, multiplication and percentages obviously is an important part of it.
Yeah, and then I guess from the English side, as you're explaining there, so if Tony, if you're dealing with a patient and there's been an incident and you need to write down and record details of that, when you go off shift and Caroline takes over from you, it's really important that she can comprehend and understand exactly what it is that you've written. So therefore, having that functional level of English and those writing skills is is really important. Just moving the conversation on, then we're talking specifically about the nursing associate scheme, which is essentially an apprenticeship scheme. But if someone did want to go to university, Caroline, are there any particular universities that offer better courses, more advantageous courses to go on? Any particular strand of nursing someone should look at through that UCAS route?
Yeah, I mean, you can go on through an apprenticeship route to do the registered nurse course, which is, again, funded, but obviously it would be at that higher level. But that's, maybe a useful route to look at an apprenticeship, because I think, apprentices are definitely being taken up by organisation because of the funding available, and also to try and reduce that debt that happens when somebody has to take out a student loan. I mean, it's not immediate, and it is over the time after they've qualified, but I think those kind of courses. What I would recommend also is that we do a pre-study course, which at the moment is virtual. So for people interested who might be eligible at fairly soon and got maths and English, can register, and it gives you a whole day session from the university where we talk about what the course provides for you, not only the nursing associate course, but other opportunities available. So I haven't got a link available at the moment, but if you go onto the University of Herts website and type in the search pre-study course, it should come up with that, and it will show you when the courses are available.
Okay.
Hopefully.
Yep.
Does that answer the question?
It did to me. Yeah, there's a couple of similar questions in here as well. If you do the associate degree and then go on to do a full nursing degree, is it still 3 years, or will you spend less time in university?
It's 4 years in total. Do you want to just explain, Tony? Because are you doing the registered nurse top up?
I'm going to eventually do it, but obviously there's other people that were there before me that will just wait to be cleared, then it will come afterwards. As far as I'm aware, it takes 18 months. So, just 2 years, just say 2 years in general to do the rest of the registered nursing degree. So, I mean, for some people, obviously, they would think, obviously, it's 4 years that, you could have done it in 3 years. However, if you were starting something, too sure what you want to do, for an extra, year.
Yeah, it's worth it. Okay, right. Tony's just frozen, but Carol, I think you're still live, so hopefully he'll be back with us very shortly.
Oh, here we are.
There he is. Sorry, Tony, you just dropped out. I think you were just concluding your answer there, which was a really useful one. Similar question then. If you wanted to, and this might be paraphrasing the last question, but I think it's important we ask them all as they come in. If you wanted to train to be a registered nurse after completing your 2-year nursing associate course, where do you study for the next 2 years to be a registered nurse?
So that would be at the University of Hertfordshire, the same higher education institute. So you can carry on. You'd have to apply to become to go on to what. So there's the 2 years foundation degree course. You get a year in practice as a qualified nursing associate, where your competencies and everything are assessed, and you're given that support. And then you can apply for the registered nurse course, and that's another, as Tony says, 18 months. And then you are qualified as a registered nurse. I think the advantage of going through the nursing associate apprenticeship course is that you've got all those things in place, and by the time you come to do the registered nurse course, as opposed to people coming in from direct entry, you've got all that experience. And I would say that the qualified nursing associates have gone on to the registered nurse course, feedback that they find it easier than perhaps other people who've come straight in. That's just me kind of the selling point for the nursing associate. But it, you know, I mean, equally you can come in, go straight in through to direct entry, you know, through to the University of Hertfordshire, which is the main HEI, a higher education institute in the area. There's also Anglia Ruskin University in Essex that provides courses, similar courses, nursing associate and the registered nursing courses. So at the moment we have a contract with Hertfordshire University, but we are looking at other options to include open universities, say, who have other intakes but do the nursing associate course, but it's all virtual, but they do set up the clinical placements as well, so your practice experience. Does that answer the question?
I think so, yeah. So it's just been asked, the same person just asked to clarify. So it's a 2-year associate nurse course, then 18 months to be the registered nurse altogether, which takes you up to where it takes you into 4 academic years, doesn't it?
Yeah. But as I say, I think the advantage is having that experience as a nursing associate, then going on to be a registered nurse. Candidates say it's, you know, an easier process. It's kind of gently getting them through kind of thing.
No, well, I guess that makes sense. Just a couple of other questions on entry route. So we're saying that it's really about the GCSE results that are the most significant. So A levels largely are irrelevant in terms of whether you do them, or which one should you do?
Well, I mean, health and social care offices is quite a good one to do. I think, is that an A-level option at the moment? I know it was when my daughter was at school, but
yeah, some schools will offer that and colleges will offer that.
Yeah, maybe some kind of science, you know, I don't know, human biology. I don't know what you'd say, Tony.
I did. I just went through it. My GCSEs. I did obviously had done engineering at sixth form level, but obviously that didn't count. I just went straight with
I mean, I think it's a good thing that you don't have to have the A-level requirement, because you'll gain the kind of equivalent level through the course, you know, and then you're at that stage. If you want to do your registered nurse studies, then you're going to be at that absolute level, if not, I would say slightly higher, level, because you gain that practical experience as well.
No, absolutely. And I guess if anyone wants to keep their options open when they're doing A levels and may still want to consider whether they go to university, then it's going to be biology. It's going to be, I guess, the sciences are going to be more significant there. So biology, chemistry, psychology are all going to be of use. So perhaps if you want to keep your options open, then that might be the.
But of course, the maths and English are the key thing, really, the sort of key to getting you in, if you like.
They are the gateway subjects at GCSE. A good question that comes in here: when can you apply for these? Is it all year round, or are there particular windows during the year?
Okay, so we do have particular windows. So the intakes are January and September, but we do allow another option for May intake if we get a lot of, you know, applicants. So the kind of window at the moment is closed closes for the January 21 intake, closes in November 23rd, so we haven't got a lot of time really. But from January, the process starts for September, and if necessary, May. So I would say January is the time to start looking and to apply onto the university. First of all, the Health and Care Academy website is really good for the application and putting in expressions of interest. So you can put, you know, that you're interested in it, what you've got, where you are at the moment, what your plans are, definitely for maths and English if you're not at that level, and perhaps the form, the expression of interest form, will give you an opportunity to put where you'd like to work eventually, you know.
Yeah. Okay. And so go to the West Essex and Herts. Hopefully I'll be able to show you that on my screen in a moment, just so you can have a look at it.
Yeah,
but yeah, if you Googled
good.
in, I've just done that, Googling West Essex and Herts Academy Care Trust, and that will get you to where you want to be. So that's the place to look there.
Health and Care Academy, yeah.
Yeah, we will make sure we put that up before the end of the slide. So Tonie, so a couple of questions I want to ask you. I mean, one question that comes in here, which is very to the point, but it's one that's an important one. Is the pay any good? Yeah, you don't need to tell us whether you've been able to afford your Ferrari as a result of it, but yeah, I mean, is nursing? Yeah, yes,
it's a red one outside. It's a red one outside. The pay is, I feel personally, obviously people, you know, will have different ways of saying that, you know, thinking in terms of like, you know, what's enough or what's not enough, depending on what you spend and all of those kind of things. However, from my experience, I feel like the pay is more than enough for me personally. I don't know obviously about others. It's really good, considering you're still gonna be working, you're still getting those experience, and you don't have any debt to you don't owe the government anything. I mean, it's a very good experience. I mean, it's very good pay for that. So yeah, I'll definitely say yeah.
Yeah, I mean, Carolyn, do you know what is the starting salary? Are there any numbers you can give us?
So it's minimum is 15,000 to start on the course. So you'd start off being employed. Am I right in saying that, Tonie? That's the right figure?
I mean, I didn't start there. I started way higher than that. So
oh, okay. But you'd already been employed by the trust, so they might have employed you at the next level.
Yeah, so I'd already been employed, so it was quite different, I guess. Yeah.
I'd say there's variation within trusts about where they start people off. So we have bands in the NHS pay structure, and band 2, and you can, again, for anybody listening, for those of you listening rather, you can go to what's called the NHS Agenda for Change pay structure, and it will show you from band 2 right up to band 9, I think it goes up to, what the pay levels are, but it starts from a minimum to a maximum. So I'm kind of giving you the minimum, which is 15,000, but I believe 15,000 it goes, the maximum is 20, around that. So you could be between those two. So, but as Tonie said, if you go as an apprentice and you're already employed by the trust, they would have to honour that you're at that same level that you're employed at. Does that make sense?
Yeah.
Sorry.
Yeah, no, that does.
Again, any inquiries, if you want, you know, there is information on the Health and Care Academy website, but I'm quite happy to take any inquiries from anyone that needs more information, and I can get the definite sort of pay structure confirmed.
Yeah, okay. I mean, other questions in terms of entry routes, as we've spoken about, you need the GCSE. So presumably someone from the age of 16 can start the associate program, which has to be 18.
18 isn't the age, isn't it, entry point? So yeah, but of course you could then start the apprenticeship route in another way within healthcare. So you can enter into apprenticeship routes at 16 to get experience within healthcare. So working maybe as an administrative support worker, or, you know, somebody. Oh, somebody who's going off to do, I don't know, support in the wards or in the community health teams. But yeah, there we are. So the Health and Care Academy website, there you can get all of the information, what the entry points are, what the salary is, and what age you can start at. But it is 18 that you need to start as a nursing associate.
Okay. Okay, thank you. Yes, so hopefully you can see the screen. So this is the Academy Care Trust website that is going to provide a whole host of information for you that will answer lots of these questions. Just a couple of questions I just want to finish up on that have come in as well. Any tips on becoming a midwife and possibly studying or working abroad? So Caroline.
Oh, okay. Well, tips on becoming a midwife. At the moment, the apprenticeship the nursing associate isn't within midwifery, but you can apply again directly to the University of Hertfordshire. That's quite an area close to my heart, because my daughter's doing her midwifery training at the moment, and it's her final year, and is training with the University of Herts. And yeah, certainly working abroad, you know, the opportunities are really good there for when you become a qualified midwife. You know, you apply to the university. What my daughter did was get some work experience. She did it in the times not when it was COVID, so she just did giving out tea and coffee and meals in the evening in the maternity unit at the Lister Hospital. So that's one way. But of course, with the restrictions at the moment, but you can apply directly to the university. They do have open days, but I think those are all taking place virtually. But you can apply to the university on their website just as an expression of interest. We are running the Future Heroes, NHS Future Heroes, which is taking place on December the 7th. And that will give you more information. The university are involved, and there's various sort of virtual stands, so you can visit, you know, organisations virtually and look at what area you're interested in.
Sure, I can't remember a question just come in. You may know the answers. Are there midwifery apprenticeships?
Yeah, there are. There's less so, as far as I'm aware, than in sort of adult nursing, mental health nursing. I think, again, maybe if they direct their inquiry to me, or then I can pass on to the university, because although there are apprenticeships available, I'm not absolutely sure about the whole host of them, because I don't run apprentices generally, but just about nursing associates. But do pass it on to me, and I'm happy to respond and find out more information.
Okay.
Anything you know, Tony, that might...
Nah, not in that department. No.
Okay, I just thank you.
Yeah. Okay. Can you do a BTEC health and social care to be a nurse?
Yes, yeah, you can. I think the BTEC is accepted. I think you might need to ask your careers advisor in the school exactly, but you're talking for registered nurse to become a nurse, yeah?
It just says nurse in the question, but yes, so I guess generally, yeah.
Yeah, BTEC will apply, yeah, because that's equivalent at A-level standard, isn't it, BTEC? Yeah.
Okay. Other question. So, how we've spoken about when these apprenticeship positions or nursing associate positions open up, but how many are there? Is there a finite number of them? Is it a competitive process?
Well, it's not that at the moment. Our numbers are relatively low. We want to get up to 50 per intake. So at the moment we're sitting at around 30 for the January intake, but of course we have not yet closed the application process for January. So our kind of maximum really that the university will accept is around 50. But I wouldn't say it's absolutely competitive at the moment, because I think the process and promotion of it hasn't been as, you know, it's not out there. The message isn't out there as much as we'd like, but I think as the message gets out there, more people apply. So, but certainly expressions of interest, I would absolutely emphasize to get those put in through Health and Care Academy website, or email me directly, because we'll pass those on to the university and to our partners, and our partners are West Herts, so that's Watford, East and North Herts, which is QE2 and Lister, and we've got the hospices, which I've mentioned already, HPFT, which I'm employed on as employed with on behalf of the Herts and West Essex ICS, and who Tonie works for, so that's a mental health trust, and we've got community trust as well. So those are our partners, and once we get those expression of interest, I can pass them on to the partners, and I say, yeah, we'll employ this person, and we will send them on to the apprenticeship course.
Sure. Okay. And the question, when we say the uni, we're mostly talking about the University of Hertfordshire, aren't we? Although, as you said, Anglia Ruskin is another one nearby that can go on there. I'm going to rattle through these ones. We're just passing 4:30 now. Can a nursing associate go on to be a neonatal nurse?
Yes. Yeah. Absolutely. Yeah. Because you can be you can work in those areas in children's nursing, and one of those is neonatal. Yep, so definitely.
Okay. If you fail your GCSEs and redo them, can you still be a nurse if it's only English and maths? So I think the most important thing is that you get the English and maths.
Yeah, I would definitely say English and maths is the most important. And you know, as you said before, perhaps a science subject, it's useful to have a science subject as well, which will give you that extra kind of you know. But I think, English and maths, absolutely.
Yeah.
Would you agree, Tonie? Sorry, I'm aware that times.
Yeah, I totally agree. It's if you just have your English and maths, or as a functional skills, is it? So I know a few people were actually doing that a week before we started on our course. So you know, you just need to get that.
Yeah. Okay. So other subjects, including science, they're not going to be crucial, but English and maths very much is the message here.
Definitely, absolutely.
We want to get those through. Okay. Where can I get work experience for this range of stuff if I'm only 16? So I think you possibly answered this on earlier, Caroline. But just give some examples of things you could do without actually going into a hospital to get them.
Yeah, it's a difficult one because at the moment everywhere in healthcare is limiting the number, but certainly in community settings, some of our district nursing teams are willing to take on volunteers. The inpatient units, you know, such as hospital settings, less so. I don't know whether you have any other ideas, Tonie, at the moment.
I think at the moment it's sort of like a tough one because of the whole COVID situation. However, I think before it would be just like volunteering, whether it's Macmillan or whether it's you know, going to hospital, at least a hospital, doing lunches or you know, doing dinners or something like that. It would be much more easier to just go for volunteer. They take up volunteers quite a lot. Rather than, you know, but at the moment, obviously, they're just trying to avoid a lot of people coming into the hospitals because of the situation we are in.
Yeah, I mean, unfortunately, there's no kind of virtual work experience platform at the moment, which would actually, I'm thinking that'd be a good idea. But we've got, as I say, the pre-study course, which is on the University of Hertfordshire pages, which tells you a bit more about how you can join that. And that gives you a flavour of what the course is about and healthcare generally. So that might be a good way of looking at it, to go to the university website and search for a pre-study course and get onto that.
For sure. Okay. Well, I mean, let me just conclude all the questions around qualifications and entry routes in there by saying, do have a look at that Herts and Essex, the Academy Care website, because a lot of your answers are going to be on there as well. I just wanted to finish on perhaps another line of questions for Tonie, just so we can finish up talking about your actual experiences in your role, Tonie. So first of all, can you tell me what are your shift patterns like, and how much choice do you get over when and where you're needed at work?
So because I work in the community, it's quite flexible. I work 9 to 5, Monday to Friday. I don't work on the weekends unless I'm on duty. So it depends where you're working. So if you were working on inpatient units, that will be totally different because they will give you shifts according to, obviously, you know, how they do with their shifts on there. But I work in the community, so it's totally different from myself and all the other people.
Sure, but I mean, Caroline, presumably, you know, your nursing associates and registered nurses are covering 24 hours a day, 7 days a week in some form, aren't
Yeah.
they? How much in the early days is it dictated to you when you're needed, or you know, how much choice do you get?
You do get a choice. You can, and because there's e-rostering now, it's much easier. It's all done electronically, so any requests are usually submitted and um, you know, honoured as long as they're put through in the kind of reasonable notice time frame. So I'd say it's a lot more flexible now, and I think what's more flexible is because we have the long day, which sounds a lot, but it works, you know. So it's usually 8 from 8 they'll start, and that's a shift across the whole of the NHS. And although it seems quite a long time to work, you know, you're not always on your feet. There are other things that you're doing, and then you get 3 days off after that, so you get a good time to sort of recover really from the long
Yeah,
day.
yeah.
Night shifts generally tend to be, I think they try and avoid them as much as possible while you're training. I might be wrong, Tonie.
We from when we were training, you were not allowed to do night shifts.
No,
Yeah,
exactly.
for the home training, so you would only do day shifts.
Yeah.
Yeah.
So that's good in your training, but when you qualify, yeah, that it's a long
Yeah.
day shift and night shift that are the 2 shifts. When I was training and when working, we used to have an early and a late shift, but now because of the 8 to 8, and then the night shift usually starts around 8:30 or 8, you know, 8:15, then that takes over. But I would say with shifts, you get a good amount of time off afterwards to allow you to sort of recharge your batteries, so you're not working a lot of shifts in
Yeah.
one go.
No, that's important. Okay, well, look, I think we've probably reached a natural conclusion there. I'm very conscious it's very dark here, and you won't be able to see me in a
Yeah,
minute.
I'm getting I'll put my light on. Yeah.
So this session has been recorded. So first of all, thank you to all of you in attendance at the moment for submitting so many really, really good questions, and really hope that you've been able to take a lot of information out of this. It is recorded, so you will be able to watch it back again, or you will be able to share it with any of your friends, perhaps that have been that are interested, that would like to find out this information as well. Our HOP website, so you can see there on your screen there, you can see there's a QR code there, which if you take a picture of that, or if you remember any of our social media sites there, this webinar will be available to watch probably from some point tomorrow lunchtime onwards, along with all the other webinars that we've been recording every week since May, one of which back in the summer was more on nursing in general. So you may well find that you want to watch that one as well, to give you a little bit more insight as well. So this will be available. This video will be available on our YouTube site. If you have any questions that you want to ask either Caroline or Tonie, we will open up the comments section on the YouTube site, so you can put those questions in, and then we'll make sure that they get directed through to Caroline and to Tonie, and that they can get responses to you is probably the best way of doing that. So thanks ever so much, not just to our attendees watching, but to our panelists who have joined us today. So to Caroline and to Tonie, thanks so much for giving up your time for today. The final slide that you've got on there as well, let me just leave this with you. There's an event on the 1st of December, which is a Tuesday. It's out of school hours, so it's 6 until 7:30. The NHS staff, some of them based out of the Lister Hospital in Stevenage, will be one of 5 STEM employers, as well as Airbus, MBDA, GlaxoSmithKline, and the Cell and Gene Catapult Catalyst organisation. So that's a very broad range of STEM and science employers that will be there that day. You can register to attend that. Again, this is designed really for Stevenage and for Hertfordshire-based students who want to find out more about careers in STEM within their local community. So if you look at the QR code on this slide here as well, that will take you directly through to the registration slot for that one. So lots of information is available for you out there. Thanks for joining us today. We hope to see you soon, and best of luck with your future career options and choices.
Thank you, Gareth. Thank you all. Bye-bye. Bye.